The FedLife podcast is presented by Serving Those Who Serve, a fiduciary, fee-based financial planning firm serving federal government employees and retirees all over the country. This podcast is for informational purposes only and is not intended to be taken as financial advice. All listeners should consult their personal advisors before taking any action. The opinions expressed by our hosts are their own and do not reflect the views, policies, or position of Raymond James. Securities are offered through Raymond James Financial Services, Inc., member FINRA SIPC. Investment advisory services are offered through Raymond James Financial Services Advisors, Inc. Serving Those Who Serve is not a registered broker-dealer and is independent of Raymond James Financial Services, Inc. And now, here are your hosts. Dan Sipe serves as a branch manager for Raymond James Financial Services and Serving Those Who Serve. Ed Zerndorfer is our guest and federal benefits expert in the space.
Hello and welcome to this episode of the FedLife Podcast. If you don't know me, I'm your host, Dan Sipe. Additionally, I'm the branch manager here at Serving Those Who Serve, Sipe & Associates. I will begin, as I always do, by saying thank you. Thank you for taking the time to join us today, but also thank you for your service to the government, to the country, to me, to everyone. You do not hear it enough, but you will always hear it here. The other thing you know, if it's FedLife, you are going to hear my buddy, the guru, Ed Zerndorfer. He's back with us once again as part of our ongoing mission to reach, teach, and serve you. Once again, we are following Ed's FedZone articles, so you can find that at fed-zone.com. It's also on the STW Serve website. And this gives us one more way to reach and teach. So if you are a listener or a viewer and that's your preference, we have you covered. You're welcome right here. So Ed, as we roll into November, you have your gaze trained on Medicare, and you have written a really great primer on how original Medicare works. So you open by telling us about how original Medicare is funded and what it means to our feds. So kick us off.
Thanks, Dan. I have to say this up front, Dan, about the questions I get about Medicare. I get numerous questions from federal employees and retirees about Medicare. And in discussing Medicare, the importance of enrolling in Medicare, it reminds me of when I talk to new employees, these are newly hired employees, they ask me, how do I enroll in a federal employee health insurance plan? What do I need to do? This is the first time in their life they've ever enrolled in any health insurance plan because they're now working with the federal government. And because Medicare is, when someone becomes age 65, they have to enroll in, it's very similar. It's shocking. They're shocked. What do I need to do? What is Medicare all about? So it's an education. And associated with that, talking about questions when it comes to Medicare, one of the most often asked questions I get from federal retirees when they turn 65, and why do I need Medicare? After all, I have my federal employee health insurance. By enrolling in Medicare, I'm doubly insured. I'm overinsured, and we're going to clear this up today. You're not. So federal employees, when they're working, are paying to be enrolled in Medicare. Let's go through the specifics here. When anybody is working, they're subject to what's called the Medicare Hospital Insurance Tax, HIT. What is it? If you look on your paycheck, you're going to see that there's a tax being taken out, payroll tax. It's called the Medicare Hospital Insurance Tax, equal to 1.45% of your wages, no matter what you're earning. You could be earning $500 a year. You could be earning $50 million a year. They're going to take out that Medicare hospital insurance tax, and that's matched by employer. So here's the rule, Dan, that during an individual's working lifetime, if they have paid that Medicare payroll tax for a minimum 10 years, any 10 years, here we have someone who's a teenager. They're working. They got, they work after school. They work over the summer.
Sure.
They're paying that tax.
That was me.
Right?
That was me 1,000 years ago.
Me too. Okay. And then they turned 18. Maybe they went to college. Okay, got it. Working in college, maybe over the summer. Maybe they went to the military. No, when you're on active duty, you get paid to take out the payroll tax, and then they get a job, and maybe several jobs. Pick out any 10 years they've been paying that payroll tax, and what's the result? When they turn 65, they're eligible to enroll in Medicare. That's the age. And they enroll in what's called Medicare Part A, the original Medicare. And because they've been paying that payroll tax for any minimum 10 years, there is no premium cost for Medicare Part A. That's called the hospital insurance. If you're eligible for Medicare Part A, that automatically makes you eligible for the other parts of Medicare, which include Medicare Part B, the medical insurance, the medical insurance that covers things outside the hospital, Medicare Part C, used to be called Medicare Choice Plans. That's why that's the C, but now they're called Medicare Advantage Plans. And finally, Medicare Part D, which is the prescription drug program. Now, all but Medicare Part A, you have to pay for it. There's a monthly premium. We're going to be talking about the original Medicare, which is Medicare Part A and Medicare Part B today.
Gotcha.
That started in 1965. As I said, Medicare Part A, there's no premium cost. The premiums were prepaid. But Medicare Part B, the medical insurance, is not free. One has to pay a monthly premium for that.
Sure.
Every month. And the amount that you pay depends on your income. The higher your income, the more you have to pay for Medicare Part B. And it's a year-by-year thing. They look at Medicare looks at your income for the previous year, and they say, well, this is what you're going to have to pay the following year. Okay? All right. So, as I said a few moments ago, Medicare Part A, a federal retiree, I had no problem enrolling in it. It's free. Why not?
Sure.
It's free. But why do I got to pay that monthly premium for Medicare Part B? Here, you tell me I can keep my federal employee health insurance in retirement. I met the requirements. And my doctors I go to take my insurance. Hospitals I go to take my insurance. So whatever, again, I Medicare Part A, I had no problem with that. If I go to the hospital, enroll in it, what you're saying is that Medicare Part A will pay for my hospital stay. Do they pay for all of it? No. Well, that's my FEHB plan. We'll pay for the hospital, whatever's in it. But this Medicare Part B, I got a problem with.
Gotcha.
Let me just say
this.
this.
We hear it.
Oh, do we hear it? If I got $1 for every time I get that question or emails, questions, Dan, I wouldn't be here today. I'd be long retired.
I know that. So I'm glad you're not getting $1 each time. Because we need you.
Okay. So we're going to talk about why enrolling in Medicare, the original Medicare, is highly advisable. I also want to emphasize, and this is important for federal retirees, that OPM does not require enrollment in Medicare, in original Medicare. You don't have to. If you don't want to, you don't have to. You're not going to be penalized. But I also want to say this, that if you are a military retiree, let's say you are in federal service and you retire from federal service, and what are you enrolled in? Something called TRICARE for life.
Sure.
When you turn 65, if I say you're enrolled in TRICARE, but when you turn 65, you get to enroll what's called TRICARE for life. No premium cost under the condition that you must sign up for Medicare Part A and Part B. You have to. If you're a military retiree. If you want to get free TRICARE for life. If you don't sign up for Medicare Part A and Part B, the Defense Finance Office is going to drop you from TRICARE. You have to enroll in it first because it's primary. And there's something else I want to mention. Used to be that the Postal Service, the employees and retirees were included in the Federal Employee Health Insurance Program. Starting this coming January 1st, 2025, the Postal Service will have its own health benefits program called the Postal Service Health Benefits Program. Federal government, Postal Service, I should say, signed a contract with the federal government in which they're going to have, it was used to cut down some of the cost the Postal Service was incurring with their employee benefits. They had some fiscal problems. Well, now they have their own Postal Service Health Benefits Program.
Sure.
One of the conditions coming out of that contract, or the contract with the government and the federal government and Postal Service, was that when a Postal Service retiree becomes age 65, they must sign up for Medicare Part A, Part B. They had no choice. They're going to have
Gotcha.
to. They're grandfathered in. So anybody who turns 65, Postal Service retiree turns 65 after January 1st, 2025, has to enroll in Medicare Part A and Part B. Okay, so let's get back to the question. Why is it so important to sign up for Medicare Part A and Part B, the original Medicare? And to help understand that, I just want to emphasize the fact that a federal retiree who signs up for, again, Medicare Part B, they always sign up for Medicare Part A, and they're at a problem with that. Medicare Part B is the fact that you're not overinsured. Medicare coordinates with the Federal Employee Health Insurance Program. You're not being overinsured. Why do I say that? If you are retired from federal service, like myself, because I'm enrolled in Medicare Part A and Medicare Part B. Well, to give you a figure here, Dan, Medicare Part A, Medicare Part B pays on average 60 to 80% of what the doctor or a hospital or a clinic is charging.
Gotcha.
And who is going to pay the other 20 to 40%? Your federal employee health insurance plans. The federal employee health insurance plans are now considered to be Medicare supplement plans, not Medigap plans, Medicare supplement plans. And they pay the other 20 to 40%. Why is that good? Because when a federal retiree who has the federal employee health insurance turns 65 and enrolls in Medicare, they don't have to go out there, shop around for a Medicare or Medigap plan. Dan, those Medigap plans, those Medicare supplement plans are expensive.
Sure.
And they get more expensive as a retiree gets older. I had an email from a Postal Service annuitant who said, now the Postal Service health benefits plans, because that's what he's going to be enrolled in, are expensive.
Yep.
Are expensive. I was approached by a individual who sells Medicare supplement plans, 60 years old. So he said to me, I'm much better off getting into that Medicare supplement plan if I have to stay in Medicare. And
Don't do it.
So what are you proposing? He said, I'm going to drop out of the Postal Service health benefits plan. I said, sir, you violated the 11th commandment.
Yep.
And what is the 11th commandment, Dan?
Thou shalt not drop your FEHB.
Or in this case, Postal Service health benefits in retirement, because you never can get back in.
Yep.
So he said, why is that? I said, first of all, the plan you bought, the person is proposing to you. How old are you, 66 years old? Mark my word. That come 5 years from now, you're going to be paying more. 5 years after that, you're going to be paying more. They go up. Age bracket. It's age weighted. You're going to be paying more. But most importantly, what type of catastrophic coverage do you have with that Medicare supplement plan? Medicare Part A, the hospital insurance, only pays up to 100 days in the hospital. What happens if you're in the hospital 6 months? Well, the Medicare supplement plan has catastrophic. No, it doesn't. That's how they get you. So he said, I'll have to take your advice. Yeah.
Oh, yeah.
Please do so. So
absolutely.
With the federal employee health insurance plans being the Medicare supplement, they will pay the other 20 to 40% or whatever Medicare Part A and Medicare Part B does not pay. Now, got to be careful here though, because as I say, Medicare only pays up to a certain amount. So when you go to a doctor, you have to ask, if you're all retired and you are enrolled in the federal employee health, you have the federal employee health insurance, you have to make sure, if you want to make sure that your costs will be covered, doctor, that the doctor does accept Medicare patients, that they do accept Medicare. Now, what is this accepting Medicare patients? If a doctor does accept Medicare patients, let's say a geriatric specialist, they have agreed to accept whatever Medicare will pay them. This is called accepting assignment from Medicare. Accepting assignment. Doctor, whatever they're charging, and Medicare pays the doctor for, let's say, a visit. Let's say the cost of a visit is $500. Medicare pays the doctor 60%, $300. The doctor has to accept it.
Gotcha.
So now, if the doctor says, I accept dependent patients now, and you have your FEHB insurance, you're all set to go. Because what the doctor will do is the doctor will bill your Medicare supplement, your FEHB plan for that. In my example here, the $200 difference. And then your FEHB plan, will they pay the $200? Maybe not. Maybe they'll pay $100. So what is the doctor going to do then, Dan? They charge $500, they got $300 from Medicare, and they got $100 from the Medicare supplement plan. That still leaves $100. So what can the doctor do, Dan?
What can you do, Ed?
Nothing.
Yep.
The doctor
can't balance
bill the patient for the $100 difference. That is called balance billing, which is illegal. When you accept Medicare patients, and this applies not only to a doctor, but to a hospital or to a clinic, for a lab, anything that Medicare and your FEHB insurance does not pay cannot be charged to the patient. It's called balance billing, illegal.
Gotcha.
So what's the result? You, the federal retiree, pay nothing. And to make my point clear, Dan, I have been enrolled in my FEHB plan since I started in federal service in the early 70s. I've had the same plan. And I enrolled in Medicare Part A and Medicare Part B almost 9 years ago in January 2016. And over the past almost 9 years, I haven't paid one penny to a doctor, to a hospital, to a lab. Thank God I'm healthy. Nothing. And my wife has been enrolled in Medicare Part A and Part B for the past, I think, almost a little over 4 years. Same thing. Hasn't paid anything. And we've had some surgeries, outpatient surgeries. One other example. I have someone who lives here in the community, used to be part of a carpool. He's 86 years old. He's been enrolled in Medicare Part A and Part B for 21 years. He had a bypass operation, heart surgery. How much does a bypass surgery cost?
I'm going to say $300,000.
I think it was something like that. How much did he pay between his FEHB plan and Medicare Part A and Part B? Zero.
I'm going to go with zero, Ed.
Yeah, you're right. Right on target. Right as always, Dan. All right. So I can't emphasize this coordination. The coordination.
Sure.
Coordinate. Again, the downside is you have to be enrolled in Medicare Part B and you've been enrolled, and you have to pay a monthly premium. That monthly premium. And another thing individuals should be aware of, what I think I mentioned is, the higher your adjusted gross income, the more you have to pay for Medicare Part B. But that should not stop you from enrolling Medicare Part B. People complain to me, well, that's a lot to pay. Well, keep in mind that the Medicare Trust Fund is not in great shape. And whatever we're paying, if you are paying what's called in the first income tier, like this year, it's $174.70 per month. This is the Medicare Part B, what's called the lowest income tier premium. That only represents 25% of what the real cost is to be enrolled in Medicare Part B. As your income goes up, the 25 goes to 35%, 45%. It caps out at 50%. Still, it's a good deal. Federal retirees should be aware of the fact that we are so blessed. We are so blessed that we have this FEHB insurer as our Medicare supplement plan. We don't have to shop around. That itself.
Absolutely.
That being said, let's talk about the specifics of being enrolled. I have in that column I wrote.
Yeah, you have a great Q&A format there.
I have a Q&A format. It's in a matrix. So let's go through some of these questions I have.
Okay, let's do it like we do in the webinar. I'll ask them, and then you can answer.
Yes.
So, can a federal retiree enrolled in Original Medicare get his or her health care from any doctor or other healthcare provider, laboratory, or hospital?
In most cases, yes, Dan. A federal retiree can go to any Medicare enrolled doctor, other healthcare provider, hospital, or other facilities that accept Medicare patients anywhere in the U.S. Now, if you want to make sure that a doctor or a hospital does accept Medicare patients, I have a website. It's in this matrix. I'll just go through it quickly here. www.medicare.gov/care, CARE-compare. Just go to that website. I'll repeat that again. www.medicare.gov/care, CARE-compare. In order to find and compare doctors and hospitals in their geographic area, no matter where they live. Okay?
Gotcha. Okay, question 2. Does Medicare Part B, like boy, cover prescription drugs?
Medicare Part B in general does not cover most prescription drugs, but there are some exceptions, okay, such as drugs for pain and symptom management for hospice care. Medicare Part B may also cover some infused and injected drugs given in a doctor's office and insulin used with a traditional pump. Federal retirees enrolled in an FEHB plan also have access to prescription drug coverage. Now, most FEHB plans do have prescription drug coverage, but also federal retirees who are enrolled in Medicare Part A, Medicare Part A, and Medicare Part B, the original Medicare, they can enroll in Medicare Part D prescription drug plan, which starting January 1st, 2025 is going to be a little more attractive because they've lowered the catastrophic limit from $8,000 down to $2,000.
Sure.
Now, I'll be writing a separate column on Medicare Part D, but I think listeners to this podcast should be aware of that. The Medicare Part D is going to be is going to be a little bit more attractive, but I just want to repeat again that I've said many times. Medicare Part D it covers prescription drugs, and for 2025 there's going to be, I think, 21 plans, but each plan has what's called its own formulary, which means the drugs it will cover. And individuals want to know if their drug is particularly covered. If retirees want to know if their drug is covered, they should go to the Medicare website because they have a tool there that will compare the plans and what is covered in each particular prescription drug plan. There are 21 plans.
Got to do your homework. So next 2 questions I think are going to surprise people for the answers. So I'm going to ask them together. Does a federal retiree need to choose a primary care doctor? And then does a federal retiree need to get a referral to use a specialist under Medicare?
Answer to both questions, Dan, no. You can use any doctor you want. But again, go back to what I said a few moments ago. Please make sure that your doctor accepts Medicare patients.
Gotcha.
That's important. And then you can go to anybody you want. Again, as long as the doctor accepts Medicare patients. I'm saying that because I got a very interesting question from someone about make sure their doctor accepts Medicare patients. So a friend of mine lives in the community. He's a federal retiree. Told me, he got the shock of his life when he called his doctor's office, his primary doctor's office, and told them that he just enrolled in Medicare. He wanted to let them know that he enrolled in Medicare. So someone at the billing office there, in the office, said, "Oh, we don't accept Medicare patients. We don't accept Medicare patients." I was like, "Oh, really? I have to think about this. I'll have to call you back." So he called me. He said, "Oh, but are you sure what you said, that if I have my FAHB insurance, I can go to a doctor that accepts Medicare patients?" I said, "Yes," I said that. I explained to him what the doctor's office meant by that is they will not accept patients who only have Medicare. Remember we said a few moments ago that Medicare doesn't pay for everything. Geriatric specialists, those who treat patients over the age of 65, they cannot afford to take patients who only have Medicare because of that 20 to 40% gap. Call back the office and say to them, "Oh, I'm not calling you to let you know I only have Medicare. I have my federal employee health insurance. That's my Medicare supplement plan, and I have Medicare." So they said, "Oh, in that case, no problem. Yeah, you can continue there." He said, the devil is in the details.
Absolutely. Absolutely. So next question. Does a federal retiree enrolled in original Medicare plan need to purchase a private Medicare supplemental or Medigap policy?
The answer is absolutely not. Go back to what I said a while back. This is one of the beauties of the federal employee health insurance. You get to keep it in retirement, and it is considered to be your Medicare supplement plan. You don't have to be, you heard of senior abuse, Dan? Senior abuse? And there's a lot of that when it comes to these Medicare supplement Medigap plans. Oh, I tell federal retirees, when you get the things in the mail, shred them. When you get emails about buying a Medicare supplement plan, delete them. Okay? We're so fortunate.
Agree. So next question. What does a federal retiree enrolled in original Medicare pay for healthcare?
They have to pay that Medicare Part B monthly premium. Medicare Part A is free. Only have to pay for Medicare Part B. Okay. Now, as I said, what they're going to be paying depends on somewhat if whether the doctors, healthcare providers, or suppliers accept assignment. Now, generally speaking, that if a doctor does not accept assignment from Medicare, they really cannot accept Medicare patients by law. They have to. This is federal government regulations that a doctor who wants to treat Medicare patients has to accept assignment. If the doctor says I will not accept Medicare patients, then if you go to such a doctor, then your FEHB insurance will be primary, and only. That's all. That's what you have. And the doctor will charge something, and now you're subject to whatever the FEHB insurance will pay for. You'll have deductibles, you'll have co-insurance that you're going to have to pay out of pocket. Okay?
Gotcha.
Also depends on the type of health care and the federal retiree needs and how often the retiree needs it. How many times they're going to be visiting a particular doctor. Sure. Assuming that the retiree's FEHB health plans, or for that matter, TRICARE for Life, coordinates with Medicare, most do, the retiree's out-of-pocket costs, including deductibles, co-payments, and co-insurance, will be minimal, most likely zero. Think about us. Nothing paid over the past 9 years, 4 years for my wife. My friend, he hasn't paid any. He all told me he's paid zero in 21 years, Dad. He's a federal retiree, has paid nothing out of pocket in 21 years. Can't say
That's
say
awesome.
it any other way.
That's awesome. Okay, so how does our Fed, who's a Medicare beneficiary, how do they know what Medicare has paid on their procedure?
Yes, what I call original Medicare beneficiary will get a Medicare summary notice, MSN for short, that lists all the services billed to Medicare. Keep in mind that the Medicare summary notice is not a bill. It just explains what Medicare paid and what from the Medicare supplement plan. Okay. It's important for the beneficiary to review the Medicare, the MSN, to make sure the beneficiary got all the services, supplies, or equipment listed. Review the statement. Don't assume it's correct. Make sure that they got everything there. If the beneficiary disagrees with Medicare's decisions not to cover a particular service, that happens. The Medicare summary notice will tell the beneficiary how to appeal. They want to say that something was not covered. They can contact Medicare to appeal that. I encourage original Medicare beneficiaries to get the Medicare summary notice electronically. Don't do it. Don't depend on the mail. It's so much easier. It's so much easier. And to do so, to get their Medicare summary notices electronically, they should go to the Medicare website, www.medicare.gov. And first of all, they should get their own account. They log in, get their own account, and to set up their account. And then a beneficiary will be sent then a notice each month and telling them that when their MSN that there is a Medicare summary notice available, they heard some services, and that's when they do it. They'll get notified each month. This way, they don't have to depend on the mail. It cuts down the paper.
Sure.
So
Yep.
I really encourage that.
Save a few trees. Yep.
Yep.
And Ed, you round out with a little more of an explanation and clarification of something you've mentioned throughout the article and throughout this podcast. So one more time for our listeners, what is assignment? When people see that, what does that mean to them?
Okay. Assignment means that an original Medicare beneficiary's doctor, healthcare provider, supplier, hospital, or is required by law to accept the Medicare approved amount as full payment for covered services. Okay. Most doctors, providers, and suppliers, they do accept assignment. However, it's important for original Medicare beneficiaries to check that their doctors and providers of healthcare accept assignment for Medicare. Because if they do not, then something's wrong here. Okay. By definition, if you agree to see someone who's enrolled in Medicare, you accept Medicare patients by law, you do have to accept assignment. And
Gotcha.
They have no choice. This is a federal law. Okay. If a doctor, provider, healthcare services, or supplier accepts assignment for Medicare, then the original Medicare beneficiary out-of-pocket costs will likely be less, if not zero. Okay. The doctor, the provider of medical services or supplier agrees to charge only the Medicare deductible and co-insurance amounts. That's the only thing they're charging. Now, whatever the deductible, whatever the doctor charge, the Medicare deductible and co-insurance amounts, and like for example, Medicare Part B this year in 2024, the Medicare Part B deductible was $240.
Gotcha.
Does the Medicare patient have to pay that? Give an example. I usually get my physical from I have semi-annual physical in January. So I went to my internist last January, and that was my first doctor visit for the year.
Right.
Did I get charged $240? No. I did not get charged because who paid that deductible, Dan?
That would be FEHB.
That's right. My company, which is GEHA standard, paid it. On my Medicare summary notice, came out in February, it showed doctor's charge, what Medicare paid, and what GEHA paid. Zero balance due. It's that simple. I never submitted a claim, did nothing. It's all there. Okay? So again, the system does work. I'm living proof. We are living proof. And I cannot emphasize enough the importance that federal retirees in the 365, or I should say, if they're still working at 65, once they retire, to sign up for Medicare, the original Medicare, Medicare Part A and Medicare Part B. I want to say one other thing here. I'm going to make an appeal. If any of our podcast listeners has not attended one of our monthly FEHB, TRICARE, and Medicare webinars, please do so. Every month we have them. And everything we talked about today, Dan, we talk about plus more, including how do you enroll in Medicare. There are different types of enrollment periods. The initial enrollment period, the special enrollment period, the general enrollment period. Yeah, it sounds pretty complicated. We try to make it very understandable.
Absolutely.
There are penalties if you blow the deadline. So that's why we really, it's important that you attend. We go through everything we talked about today plus more. They're held monthly. You can attend as many times as you want. Just go to www.stwserve.com and sign up. We hold them every month. And we're going to have one, next month, the month after. So please consider it.
Absolutely, folks. And that is by design. Ed and I have both been doing this for a long time. And just thinking about this stuff during open season, it's too narrow a period of time. You need to have time to digest and understand and formulate a plan. And that's why we run these every month. There are actual jokers out there that are saying it's a waste of your time to go to these more than once. No, it's not. Okay. Getting a better understanding of this allows you to get the most out of the benefits that you have earned. You deserve this. So we are happy to run them every month. Come every month if you want. You'll never hear us complain. And folks, the other thing, I can't say this any clearer than this. There's only one Ed Zerndorfer. There's nobody that can go as wide and as deep. Ed, another great article. And thank you for what you bring.
My pleasure. It's always a pleasure, as I say.
And folks, that's a wrap. We are, say it with me, serving those to serve. Be sure to subscribe to this podcast on our YouTube channel and Spotify. So hit that subscribe button and share it with friends and strangers. You're going to change their life. I promise they're going to be better off. And as Ed mentioned, don't forget those live webinars every single week. We do FEHB every month, but we do a ton of stuff. We do FERS, we do TSP, we do Social Security. It's all in there. None of this nonsense. You only come for everything jammed into 1 3-hour webinar. That's nuts. You deserve more. We make sure you get it. So head to stwserve.com. You'll see the webinar button. It's blue. Hover over, it turns red. Click on it. You get the whole menu and you get the guru. Ed will come to you through the magic of the internet to reach you where you are, teach you where you are, and above all, serve you where you are. Sign up for one, sign up for all of them, and share them with your friends. They will thank you. So be sure to read Ed every single month in the Fed Zone. We feature a lot of the articles here, but not all of them. So you can find that at fed-zone.com. Also at stwserve.com, you can get there. So in closing, for my buddy Ed, the crew at Serving Those to Serve, and me, Dan Sipe, I'm going to close out, as I always do, by saying good luck, Godspeed, and above all, remember, it's your FedLife. Make it a great one because you do deserve it. Stay well, everybody. We are out.